Los Angeles County broke yet another grim record Wednesday, December 23, reporting that another 145 people had died from coronavirus-related causes, breaking by 7 the previous high set a week ago, as the post-Thanksgiving sure continues just days before Christmas, another holiday with the potential to accelerate the virus spread. The latest figures included 14 people whose deaths Long Beach, which has its own health department, reported the day before. Since the pandemic began, 153 people have died in LA County from complications related to COVID-19. Health officials said Wednesday that if nothing changes with people's behavior soon, an additional 600 people could die before the end of January. "We will not be able to sustain the increases predicted by the model if they come to fruition," said Health Services Director Dr. Christina Ghaly. Wednesday's new cases were also among the highest reported in a single day, with 16,525 positive results posted. That's the highest ever, after subtracting backlogged results reported on December 16, when more than 22,000 positive cases were reported. Long Beach on Wednesday reported another 8 people had died from coronavirus-related causes, which was the city's second highest single-day number of the pandemic and brought the death toll to 341. Long Beach also reported 1,002 new cases. 719 cases have been identified there since the pandemic began. Pasadena, which also has its own health department, reported 4 more residents had died from coronavirus-related causes, bringing that city's death toll to 150. Pasadena also reported 80 new cases on Wednesday. The city has reported 5,892 coronavirus cases since the pandemic began. Stories from doctors and nurses at hospitals conveyed a dire reality that, as of Wednesday, LA County was still facing an unrelenting surge. Frontline workers were treating 499 COVID-19 positive patients spread across 85 acute care facilities, 280 of whom were in intensive care units, according to a state dashboard that reports numbers a day earlier than the county. With ever-increasing totals each day, officials have openly worried that the worst was yet to come, predicting a peak in hospitalizations as much as 50% higher than what facilities currently face. Under the worst scenarios, daily hospitalizations related to the coronavirus could reach more than 11,000 in January. By a more modest estimate, hospitalizations will reach 7,500 by next week. The number in ICUs, meanwhile, could reach 2,800 by January, 2,400 without any change in behavior.